Hour, the GOP takes its turn. So what is the Republican solution for this issue? Congressman Trent Franks of Arizona joins me now. Congressman, thanks for joining us. Happy Thanksgiving to you, sir.
And to you, Kelly. I guess I just want to join with all Americans in just thanking God on this day for the blessings that we have as a country that have been enjoyed by no other in the world. And especially want to express my gratitude to the troops. They are out there in harm's way this moment so my children can be safe on Thanksgiving Day, and I'm grateful to them so much too.
Well, Congressman, having a sentiment like that, I'm sure that is bipartisan support from Democrats and Republicans alike, as well as all Americans. Having said that, though, there is debate on the health care reform bill that's before the Senate. When people return next week, the Senate will be dealing with that, with the Senator Harry Reid bill, the Senate Majority Leader. A lot of Republicans simply aren't in favor of that. Why?
Well, you know, I guess, Kelly, I could tell you a lot of different reasons. We're concerned that it's going to kill jobs. We're concerned that it's going to cost taxpayers enormous amount of money. We're concerned that it's going to stifle innovation in healthcare, which is the only long-term hope to really make the system work. We're concerned that it's going to get between the patient and the doctor. We're concerned that it's going to damage the healthcare quality in this country. We're concerned about a lot of things, but the big one we're concerned about, at least I am, is just the impact that it's going to have on American freedom. You know, I've got two little baby twins at home, and I want them to be able to walk in the light of liberty like I have. And this is, I think, unfortunately, an attempt on the part of many Democrats to buy the 20 or 30 million votes that they believe will be susceptible to the same old nonsense lie that socialism is always sold, and that is that somehow you can give up your freedom and get something free in terms of government service, and the government really has nothing that it doesn't take from some other part of the population. And the bottom line is, everywhere socialist health care has been put in place, it has led to rationing, it has led to a diminishment of the health care quality, and it has increased costs. It is just a losing proposition, and I don't understand why liberal Democrats can't get a hold of that. The people have been telling them that now for months and months.
All right, Congressman, let me ask you then, is there anything about this bill that you can support?
Well, I mean, I support the idea of reforming America's healthcare system, but it should empower the individual, it should empower the patient and not government. Republicans have, several bills in the system that I've actually even co-sponsored that would do tremendously more good for the healthcare system than this maniacal boondoggle called the government healthcare takeover. What the Republicans would like to see would be to empower patients, empower individuals who cannot afford health care, to empower them to buy the health care insurance from the private sector of their choice. We can fix what's broken without breaking what's working, as it's often said. We want to try to do something about the frivolous lawsuits. We want to empower people to buy health care across the board. There's about 1,500 insurance companies in the country, and if they're free to buy that, competition will ensue. We want to try to see people with pre-existing conditions have a health care system that they can access effectively.
Okay.
And there's so much that free enterprise can do for the system if it's just allowed to do it. It's given us the greatest economy in the world, and it can allow us to keep the greatest health care system in the world if we'll let it happen.
And Congressman, if I might add, a lot of those things of which you said have been introduced to the Democrats as well as the President, to the extent of which the Senate has agreed to interstate competition between the insurance companies, as well as that malicious tort reform that they're looking into as well. Those are all things going forward, looking forward. Having said that, is there any
But they're not in the bill.
I'm sorry?
They're not in the Democrat bill.
We're getting word right now that the interstate competition is included in this Senate version. Am I wrong about that, sir?
Well, I mean, I have to be quite honest with you. They may have added something that I'm not aware of, but
well, it is 2,000 pages long.
So yeah, and they got the word "shall" 3,400 times. I mean, they're mandating somebody to do something 3,400 times, and centralized planning never works. But in this case, they're actually robbing Medicare of about $400 or $500 billion, and and the cost of this thing is over $1 trillion, and that's a conservative estimate. The indications are, when Medicare first came into being, they expressed that it'd be around a $12 billion program. Well, just within a few years, it was 9 times that much. And this administration is spending America into oblivion, and it is putting this monstrous idea of government being able to control health care better than private individuals do, and it never works. If they save money with government health care, it will be a first in human history.
Obviously, the Obama administration has its task before it to do something about health care reform. Americans want to see health care reform. You have stated you want to see health care reform. Democrats want to see health care reform. How do you get there and still deal with the economy that we're contending with today, as well as the war in Afghanistan and Iraq?
Well, that's a critical question, and first of all, you have to do no harm. The idea of reforming health care on the backs of taxpayers, that's not going to work very well. I mean, that's only going to add to the burden on the economy. It's only going to diminish the numbers of jobs available. It's only going to put more weight on the taxpayers. And so we have to be able to do something that will do as Americans have always done, and that is to rely on the free market principles to give us greater innovation, where you get more health care for less cost because of new innovations.
And again, sir, a lot of people would agree with you, even blue dog Democrats, but the point is people are not seeing eye to eye on Capitol Hill, so when it comes time to return to the Senate next week and this debate begins, it may be a long debate before we even see some semblance of a health care reform that can be presented to the president that has any inclusion of bipartisan support. Sir, I wish I had more time to talk to you.
No, I understand. Thank you. Let's let all the Republican ideas at least be heard, and that's a start in the debate. Thank you, sir.
All right. We thank you for expressing the Republican side, and again reminding everyone we heard from our Democrat side the hour before. And that, of course, we wish you a very happy Thanksgiving, Congressman, having said that.
Thank you, sir.
Good day to you.
For us